abawala nti bw'okola kino ne kino period zo tezikuluma, bw'okola bw'oti ne bw'oti period ekendeera, bw'okola bw'oti ne bw'oti tofuna period. All those things by'owulidde ng'owulira tobikakasa, and you want to really know what's true and what's not. Today to be tackling itako number 0707-102-102. We are live on Galaxy FM TV. Genda ku YouTube nonye ekigambo Galaxy FM TV. Tuli live. And of course, yes, Doctor, mbadde njagala kubuuza. Waliwo demo omu yajja nanyumiza emboozi. COVID nga yakatandika okuggwaawo 2021 nga ggwako. Nangamba mbu bamugamba mbu bw'omira empekeze ezaalinga eza COVID ze baagabanga zaakenderezangako kuki ku bulumi bwe wayinanga obwa cramps ezo obwa periods ezo. Omwana ero yazettanira. Jukira gundi empekezo zitreatinga bintu bya njawulo, and you're pumping your body with a lot of medication which is necessarily not being used for the right cause. Empeke zino n'empeke endala, because waliwo abawala bamira empeke ez'enjawulo. There are very many painkillers on the market. Painkillers kyeziyinza okukola before nga sinadamaginga liver yange giwa ddagala liteetaagisa. Painkillers kyezikola oba tezikolerako ddala, sticking to the natural things.
Okay. So nga wokyogedde abantu abasinga bakoze nnyo kye bayita self prescription. Ekiriidinze nnyo kye tulabye nga mu busawo kye bayita antimicrobial resistance. Kati nga gw'ogambe yali akozesa eddagala lya COVID. Those were many antibiotics.
Okay.
There is no any use of antibiotics omukyala wabanga ali mu periods. Ziba tezirina kye zigenda kuyamba. In other words, ziba zigenda ku affectinga. Lwansonga one, omubiri oli muguwa eddagala lye guteetaaga. So in a long run gutuuka ekiseera ne gulimanyiira. Buli gy'okoma okubeera exposed to kintu nga we tulaba nti otandika ne nayiro ng'onywayo bote emu n'ogenda nga weeyongera omubiri ne gumanyira emu ng'emu tekyakkuba. So kyekimu ne gana amalagala nti ddagala kasita olyemanyiiza nga tolyetaaga lituuka ekiseera omubiri ne gulimanyiira ne yirekerawo okukukolera. So in the nearby future oyinza okulwala and you really need that antibiotic. Naye ne bagenda ogikukuba nga tekyakukolera. Ate ng'era endala gye bandikozesezza very strong. Like you have something that is very mild nga teyeetaaga antibiotic eri strong. Sinakindi, it's very expensive. So tulaba nti it costs us in the long run. Ogenda kulaba nti weetaaga eddagala bakuwa eddagala terikyakukolera. Kyovula ebiseera bino ebisinga oli agamba nze ine eddagala terikyankolera lino wendimira terikola. So it's because of that. Naye mu nsonga ya painkillers, this cramps okuba nti it's pain. The treatment is painkillers true. Naye we tubanga tumanaginga any type of pain mu busawo waliyo kye bayita analgesic ladder. Nti pain ya njawulo. Oli emmotoka gwekoonye nafuna head injury, eddagala bamuwa ya njawulo. N'oli eyeekoonye ng'afuluma oba oli ayina just a mild headache. So waliyo ze bayita mild pain, tulina moderate pain ne severe pain. Kakati zino cramps oba menstrual cramps, it's mild pain. So mu zino mild pain tutera kukozesa painkiller ezisookerwako. Tukozesa Panadol ne tukozesa Ibuprofen. Waliyo abuuzizza agambye nti yali akozesa piroxicam ne bamugaana. Piroxicam is somehow a stronger painkiller. Nti gwe tuddako zino ezisookerwako weziba nga zigaanye oba ng'oli alina some sort of moderate pain. So zezo ze tuba tuddako. Naye ebiseera ebisinga tulabye nti abamu baagala ekikolerawo ng'oli omutwe ne guba nga gumuluma ajja kwagala agenda okufuna morphine oba afune painkiller eya waggulu ennyo. So n'olaba nti kasita omubiri agumanyiiza eyo
agenda okudda
kapanado nga threshold already omubiri wagu functioning anti gwamanyira kiri ekikuba ennyo. So kati kasita oleeta buneeno nga buba tebugenda kukwera. But initially menstrual cramps tuba tulina kukozesa zino painkiller ezisookerwako analgesic ladder, zi Panadol, zi Ibuprofen, tuba tetulina kusukka waawo.
Okay, njagala kuwulira ku ggwe ekyaliwa nga mpuliriza ask Dr. Okoth Derek about that menstrual cycle engeri gyekulumamu. Let me hear from you. Galaxy.
Hey Otis, thanks for the show. My question is, emyaka emituufu egy'okavinirako sex giba emeka health wise, cause there is this propaganda nti omwana bw'akola sex nga muto asobola okudamaginga munda we na failing ofuna olubuto ng'akuze. Kati dokita atubuulire the right age to have sex, please.
Okay, ayagala kwegatta ebibuuzo awulira bingi nnyo.
So one, that's not a propaganda. It's really so true. Nti omwana omuto 9, 8, 10 years, like the reproductive system ebange ekyakula, the vaginal walls are still so narrow, so kasita yetanira mu kino ekyokwegatta abamu bafuna zi tears, abamu ne bafuna zi rupture, so in a long run nti that trauma alone esobola okudamaginga uterus ye, esobola okudamaginga vaginal walls ze, so n'atasobola kufuna lubuto bulungi emyaka egijja mu maaso, oba si kyo ne walufuna nga ajja kufuna mu complications mu kuzaala. So lubanga olubuto abanga tajja kuluyitamu ng'omuntu omulala alina waluyitamu. So that sex that is initiated at a very young age, one, it's very traumatic. Lwansonga nti omwana aba akyali mufunda,
she's not yet ready
oba
for
ogenda
that.
kumuyuza, so kasita omuyuza ajja kuhiringa nga forming ezo enkovu that will further make the birth canal narrow. Nti enkovu kasita ziforminga tumanyi nti enkovu yo testretchinga, ate ng'omukyala wabanga azaala eno vaginal wall erina okustretchinga omutwe gw'omwana ne guyitawo. So wabanga ono omwana yatandika okwegatta ng'akyali muto ne bamuyuzaako, abamu ne bagenda ne babatunga n'obatunga, tutera okubafuna ng'oli omwana muto bamurepinze abadde ava ku ssomero, but the sad part of it osanga nti amurepinze wa myaka 3, myaka 4, nga repinze mwana wa myaka 9, so ne bagenda oleeta omwana nga she's massively bleeding, nga amuyuzizza, they have got perineal tears down there, so n'ogenda okumutunga ng'enkovu omwana ono zagenda okufuna aba ayinza okuba nga tajja kusobola kusindika mwana lwansonga nti zino enkovu tezijja ku expandinga bulungi mwana kuyitawo, so n'olaba nti bajja kumulongoosa bulongoosa.
Okay, so besides the age that is consensual eya wano eya Uganda which is 18, waliyo omuntu asobola osuuka emyaka 18 nga they are not yet ready for sex, I think.
Scientifically, by the age of 16, reproductive cycle y'omukyala ebanga eri fully developed.
Okay.
So it could be the achovolamu. In some other countries, the consensual age is 16, some is 15, but it depends from where you are. But with the nature of science and biology, yo etugamba nti by the age of 16, reproductive system y'omukyala ebanga eri fully formed.
Okay.
But still, tegitegeeza nti you're ready for sex. I always tell people nti when you think of having sex, just wait for me to disemo manyenti. Are you ready for the consequences of sex? You may be 16, but when you can't take care of a child, even if you get pregnant, tomanyi or mwana agenda kubeerawa, the person responsible tomumanyi, if you get HIV, so ebintu ebityo. So one, first know the consequences of sex. Kasita obitunulamu byonna n'omanya nti I'm ready for this, I'm ready for pregnancy, if I get HIV ebintu ebityo, then you will be good to have sex. Naye nga kasita okiramu you're still in school, olaba nti omubiri is not ready, oyinamu complications bwezityo, then you're not ready for it. Just look at the consequences. Oyina HIV, oyina school dropout, obanga okyali mu ssomero and you're looking at sex. How will you manage the consequence that obanga ofuna olubuto, you dropped out of school in senior 3, senior 2? How will you manage that consequence? So first weigh the risk and the benefit of sex. If the consequence is you're not ready for it, then you're not ready. Yeah, so or you can have protected sex.
All right, 0707102102 Galaxy.
Actually, like nani njagala babuuza, like bwembeera menstruation period zange, like I lose appetite, mba saagala kulya ate like I vomit a lot, kiviirako ki? Buli lwengenda bwe nti mba nsesema, like mbeera sirina appetite, like that, ki ekibireetera ebyo nali nsaba kungambako.
muddemu oyo.
Okay, so nga we twagambye nti it all starts with from the grassroots. It starts with the hormonal changes. Zino hormone kasita zijjamu, the moods change, the body demands zichanginga, amaanyi, the body activity and the general physique byonna bikyuka. So the appetite alone, it's kivako yo hormone estrogen etera kuleeta some effects nyingi nnyo, but they keep varying from person to person. Ojasanga abamu, I've seen people and I've admitted people just because of menstruation. Yeah. So the way they react to this hormone, it's varying amuko. Abamu bajja sesemu oli afune fever nga inzoloza ina ne malaria, so ebintu byebito, it's just because of the hormone.
Okay. Yeah. 0707102102.
Hello, ono Amina, mbadde mbuuza nti no ki ekiyinza okuviirako omuntu okuba ne blood clotting during periods?
Okay.
Yeah, so ekya blood clotting, one, omuntu wabanga ali mu menstruation, there are some characteristics of menstrual blood. Menstrual blood taba clotted. Anyway, aba alina okuba fresh flow. Kasita omwana ajjamu paadi ye talina kulaba any blood clot. So kasita abanga azifunye, we want to first look at her hygiene. Ayinza okufuna menstruation naye nga hygiene ye mabega tebadde nungi. Abadde afuna this abnormal vaginal discharge, ebintu bwe bityo, it can contaminate that blood. And this being that guno omusaayi guba gugenda sooka gubeere from the uterus coming down, kasita gubeera stagnant for that long ate nga hygiene yo tebadde nungi, it can clot up. Okay? And sometimes it comes around with a bad smell. Then 2 is the sexual activity. Zino close tutera nnyo okuzira mu baana ababa nga she's in her periods but still sexually active. So this blood, it keeps coming out, you're taking it back in. So in that process, era gusobola forming those clots, and they come out along with the menstrual blood. So it's mainly 2, the hygiene, and then the sexual activity during your periods.
Okay, nyabo wekume ngoli muyonju. Yekumya tanga muyonju. Omanyi some girls put a lot of things there.
Yeah.
Bateekateeka ebintu bingi nnyo, mbusima bamugambye kano kongeza obuwoomi, kano kongeza amazzi, kano kongeza ki. They contaminate that place and make it very difficult.
Surprisingly, some even go ahead and use the local herbs. Abamu bateeka ebisubi, ebikoola. So all these, they are not really hygienic. It can be associated with that in the long run.
Okay, Galaxy.
Hey, doctor. Hey, Galaxy. Okay, when I'm cramping too much, kuntela kunywa ki Coca-Cola kuba nalimira pyroxcam ne bamungana yamira ko diclofenac ne bamungana. While we were at school, waliwo nansi yalinga tukuba some piso kati nze kyenku these days mbadde nga nywa Coca-Cola mungi. So is there any effect? Now someone used to tell me mboki onywamu ka Uganda waragi naye kati ffe waffe ng'egye tutalwa mwenge. Uganda waragi yakola ki? Yagaana. So mbadde nywamu Coca-Cola. So is there any bad effect of taking a lot of Coke?
Yeah, that's a nice one. And wetubanga tumanyijinga abawala ababa ne these cramps, before we initiate the medicine, tusooka ne tutunula the normal changes ze bayinza okukola, the exercise, taking a warm drink, the warm compresses. So for Coca-Cola ina some small percentage of caffeine in it. Kakati ono caffeine aina effect on they are called prostaglandins, zeziyambako muscles okucontractinga. So kati eno caffeine reducing that hormone, the prostaglandin hormone. So kati eno hormone kasite reducinga contraction kuzino muscles za uterus naye begenda ku reducinga so nolaba nti in a long run naye Coca-Cola naye akendezako ko your pain. It may be coke, it may be coffee,
so anything with caffeine,
yeah,
kasito yingiza caffeine mubiri,
exactly,
the contraction ya muscles zino
ekendera, exactly,
okay.
Ayinza okutaba coke, you may take abamu banywa just chai and it also reduces the pain. Nescafe, anything that has caffeine in it, it reduces the menstrual cramps.
Kali interesting ako. Naate munnaye ekintu kyonna bw'okisussa ate kiba kibi.
Don't want to become an addict of caffeine.
Oyinza okubeera addicted to caffeine and all those. I used to be addicted by the to energy drinks. Omanyi sinywa kati nga bwe ngenda mu bbaala nsabayo ka Red Bull oba akantu konna nga ka energy drink ka Power Horse biki. I reached the time nga sikyebaka. Ekyokubiri nga mbeera hyper nnyo ng'ezo luzuba.
Like you need it every time.
Yes. So if you don't actually control yourself oyinza otuuka ekiseera nga you need it that much. Galaxy.
Lero jawo tesi nze mbadde mbuuza musawo. Nze mbeera mu periods omusaayi gwange gufuluma nga mungi ate mu kufuluma ne gujjiramu ebitole ebinyamanyama and I've ever had some people saying that wobo oli mu periods ng'omusaayi gwo gujjiramu ebyo ebinyamanyama
ekiyinza okuviirako omuntu
okuba okufuna olubuto biyinza okutawaanya okufuna olubuto otawanyizibwa mu kufuna olubuto is it true or just some propaganda?
So I think she touches on the question gyetubaddeko eya blood clot gyetuzeemu, but she touches about blood flat enyingi. Waliwo omuwala wano abuuzizza agambye nti me I flow like for 20 days a month. Simanyi oba kisoboka.
Yeah, kisobokera ddala ekyo, but at least I can be very sure she's either using some family planning or atera nnyo okukozesa zineno emergency pills.
Okay.
So ezo ziteoleta that prolonged flow of menstruation. It's a side effect.
Okay, there is a Sarah here from Nigeria. My question is, why do I have pain while having sex? Nyine myaka 25, but I've had sex 6 times and with one guy all through. Naye mbala obulumi bungi nnyo. Nyine myaka 25. We touched about the reproductive system y'omuwala okubanga eri fully developed at 16. Ono I had probably like 10 years more than that. More than that. So ayinza kuba na buzibu ki, Sarah?
Yeah, then Chenyezo Gamba, sir, the problem may not be her. So I would be interested because oyinza okuda nga the sex is really so aggressive. Yeah.
Barwana.
Exactly. Or even the size of the man, the sex being aggressive, so ebyo byonna be contributing. But still, ayinza okuba amune any infection in her system, like the general UTIs, the STIs, it can also be associated with that pain. Yeah. Then also, we also don't want to rule out cervical cancer. Cervical cancer nayo, but the pain in cervical cancer is a bit different. Into your eberao during sex, then shortly after sex, you always experience that bleeding. Into obango mazo okwegata oja ku bleedinga. Then webawadde mu kikola, the pain was very painful. So abanga ainezo symptoms, it would be better nagera na screening a cervical cancer. But let her just look back. Is the sex aggressive? Ayinzo gamba pain kumba obuzibu tebuli kuye.
Yeah, ina manyi just manyi.
Yeah, manyi.
Obanga yakula munene nnyo.
Tamu preparing bulungi, so all that can contribute.
Okay, Sandra, soko gende okebeze if you've been sure nti omusajja ono talina maanyi mangi nnyo galinga gaggolola nti size ye si nnene nnyo, ekyokusatu nti yakupreparinga bulungi n'obanga you're wet enough for him, and of course ekyokusatu ekyokuna wadigenze n'okebera. I have someone here, I want to get like 2 more tulabe nga tuggalawo. There is someone here saying I have never had sex since my childhood. Nina emyaka 2. Is it bad for my body?
It is totally not bad. Actually, it is very good and safe for them. Is it a man or a woman?
It's a woman.
It's a woman.
It's a woman. Muna waliwo abawala nga sobola tuka emyaka 26.
Yeah.
Nga mbeerera naye nga bamugamba omanyi I wouldn't want to call it stigmatized, but they shame them a lot.
Yeah,
it
always comes with a stigma as well, especially for those in school and you have that peer circle around you. But one, it is very good to delay your sexual activity. One, ajaba you're protecting all these risks of unintended pregnancy, the HIV, all those other STIs. Her mentor is very, very oriented, so it is very healthy. There is no problem with it at all. Actually, it's advantageous to you.
Advantageous to okwekuuma n'oba nga teweegabanguza otyo.
Yeah, exactly.
Okategedde baby. There is no problem in being a virgin. There is no problem in staying safe. I want to get just one more like this so that tuyitamu olunaku olwaleero. Olwo yambuuzizza wano nti afuna obulumi mugundi mu bagita batya ey'emabega, the spinal cord emabega awo. Obulumi obwo buva ku ki? Is it the cramp still?
Yeah, one, it's not the spinal cord. It's the spine itself. Kuba abantu ebimu we don't differentiate this. Spinal cord, they remove that vertebra. So all along
magumba gagakuuma spine.
If it was a spinal cord, you wouldn't even be walking, you wouldn't even sleeping. But it's okay. Abamu bachi mistaking. They just say the spinal cord. Omugongo gumuluma gamba spinal cord emuluma. So this kind of menstrual pain, abafuna, if I could just define it in a medical term, it is lower abdominal pain that radiates to the back and the anterior thighs. So ajofuno obulumi wano wansi wa abdomen oba pelvic ye naye nga abuliramu ne mu bisambi oba ne mabega mu kiwato wansi naye seno waggulu. So it's normal if it's at the back, but it's not the spinal cord.
It's the spine.
Yeah.
All right, let's get just one more like this. Tuvenga tuyita mu Galaxy.
Hello, Galaxy. Masao Dokita, how are you? Banze mbadde mbuuza kitegeeza kino n'owala mu mwezi ogwo n'owala nga 5 n'ovaamu ate mwogwo omwezi gwennyini n'oddamu okulwala nga 25 kitegeeza ki?
Okay, oyo cycle etagipima bulungi, but please expound on that.
Yeah, but still, while we have a cycle yawe, it's 28 days, abamu it goes up to 32. So the ones of 28 battle ocular periods is like 2 times in a month, like in the beginning or towards the end. So it's also normal. That means cycle ye about 28 days. Yeah, teina kumuwaringa. But abamu bachilokingira kuli to the 32 cycle, the 32 day cycle. Timumwezi period as a mundi gumu. It's also very normal. It's due to the as you're moving ngokula hormones ziba zichuka nga itwale tuchogerako. So jako mokula, it will resort back to the normal 32. Yeah.
Okay. So as we wrap up, Dr. Derek, of course, what's the best way mwada inaja solo kwe kuipinga to go through these periods, go through these cramps? What should they expecting obulumi, what are expecting obulumi? Bulumi chibwa inzo uli anagama nti kagende mu ddwaliro nti this is normal, kanchi withering out, because some people are that strong. Olaba omukyala nga azze ku mulimu naye nga ali mu period emutta naye nga ali mu kuyiriba. So what's the best way that girl can equip herself okuba nga ayita mu mbeera bweti?
So one, I always encourage girls to know their cycle. Trust me, omuwala wabanga amanyi cycle ye, it gives them that psychological preparedness. So kasita oba nga okimanyi nti tomorrow I may start experiencing this and this. The mindset alone is fixed to that. So mbiri guba gujja kumanya what to experience and what not to experience.
Okay.
And then 2, menstrual hygiene is really so key. Women should be prepared to see their periods at any time. If I told you in reproductive age, that's why sometimes they tell us they don't check in ladies' bags. They have to be prepared at all times for the concept of menstrual hygiene. One, abakyala abamu balinda pads n'ensooka zijjula ne balyoka bazikyusa. But basically, on average, omukyala alina okukyusa pads around 3 to 2 times, okay, talinda pad kujjula because eyo pad bulijjo ekoma okubeerako guno omusayi kasita gufuluma ne gukoma okubeera into contact with your body again gusobola okufuuka infectious to you so aba alina okukyusa. The hygiene must be very very key. Make sure you bathe, you change your pads regularly, know your cycle as well, then body activity. Abakyala abamu beesaasira nnyo kyafunamu ka periods tayagala kuva mu buliri ebyo byonna so buli omubiri gyakoma ogumanyiza bwe gutyo nagwo kye gujja otambula nagwo but if you prepare your mind you tend to ignore this menstrual pain ojasanga nti you can do away with it. Expect the pain though it should not be so severe. Olaba nga the pain is not manageable but I would still emphasize abana abawala let them not resort to the medicine as their first alternative. Kasokola ku exercise pain negana onywedde ku mazzi okozeko ku one compress pain negana that's when you can consider painkillers. Nayo oli ayinza obaya kala periods ze pa n'anoonyezaawo panad n'anoonyezaawo ibuprofen that's also not good. So you only come to bring in the medicine ng'olabye nti zineeno the normal physiology gyokoze biganye that's when you may use those painkillers. But still I would still emphasize the pain should not be severe. Kasita olaba nti your menstrual pain ezene symptoms endala the blood clots, the painful sexual intercourse, always seek medical attention. Kuba you may have a cervical cancer that's still developing wekiba nti tujukute at early stage tusobola okujjanjaba n'otereera. If it's your hygiene and you seek up medical attention tusobola okujjanjaba n'otafuna ezo complications za pelvic inflammatory disease. So I would still drive my emphasis on menstrual hygiene and then abantu avoiding self-medications. Self-medication tekitegeeza nti neddagala lyetugula eri abasawo lyokka. We have seen many going into herbal nga wokyogambye abamu banoonya amazzi they want to be sweet all that it's also not good. So self-medications bazirekerawo let them always seek out medical attention from a professional person. But otherwise menstruation is not only an issue for the women. Nyongero, I always talk to the boys to support these young girls, especially the boys in school but also out of school. Omwana kasitaba nga ali mu periods, support them other than giving them the stigma. Kasita tulaba nti eno stigma tugijjeewo ladies will feel free talking about their periods. Naye ojasanga ng'omuwala yo in a relationship naye nga just okugamba nti ali mu periods ze nga kimutiisa because of what she has been seeing on you, you're not supportive. So menstruation shouldn't be an issue for only abaana abawala. N'abalenzi they have a key role to play because if they are not infected by itself in the long run they may be affected by it.
That's important. Speaking about professional help, omuntu aba yagadde okusangako to seek some advice as regards medical procedures and medical advice ayinza kusanga wa.
I remember Roger the last time I was here when I went out of studio I really got young people reaching out but they really had issues that were really so crucial and I was able to help out some of them. We had cases of the unsafe abortions, whatever reaching out for HIV, they weren't on treatment, they tested, so eneba opportunity nyingi nnyo and that's why this time I'll go forward and give them my contact as well so that they can feel free because I like what I do. Nyumirwa nnyo okola n'abaana bato helping them health wise. So I work with Naguru Teenage Information and Health Center tusangibwa Bugolobi opposite Village Mall. Mudwayo ly'ekiswa you can go in n'obuuza wali Naguru, they will bring you to us. Naye tukola just ku baana bato both male and female between the age of 10 to 24. Naye wobanga yo above that especially the ladies or the men even because abana batero bane ba sexual partners ate we tuba tujanjawa these STIs, the sexual partners have a big role to play. So n'abakulu let them not shy away. They can also come. We have a support system or our linkage system that we can be able to help them. Then if at all you have a concern and you may want to reach out to seek for an appointment, strictly medical appointment, you can reach me on my personal number. It is 070 65 724. You can leave a WhatsApp message or you can call any time of the day, be it day or night.
So kokademo kanambako?
The number is 070 65 51 724.
Okay, if you're reaching out, please reach out professionally to seek for advice, not personal things. Oliotia doctor nakulide dobozi yodunji nnyo nedda twefuge tuberenga tuliba kabinyo. All right, we link up tomorrow same time 10 p.m. to midnight. Tujja kuba tulimu the love puzzle. I'll be here same time. My name is Roger Otis. Good night, lovers. I out.
Chintu's drink is giving back. Galaxy TV. Jikonkone.